So I think that the two big ones are, well, the first big one I'll speak on is collectively bargain, and that's a second opinion list. So we have in our agreement with the league that a player is able to seek a second opinion for an injury that is, there's a few caveats, but one would be over 2 weeks long, or an injury that would require surgery, or an injury that they think requires surgery that the team does not. So under those circumstances, plus two other, a player can seek a second opinion, and that second opinion is paid for by the team as long as they're notified in writing. And that's all the expenses related to that second opinion. And I think that's really actually just good practice in medicine. I think, frankly, every person should probably get multiple opinions on something, especially if it's a career-altering injury, if it's something that's causing you a tremendous amount of pain. So it's probably just good medical practice, but specifically in professional sports, we've seen the impact that injuries can have on a career. So I think getting multiple opinions, if not at least two, on a certain injury is important, because we've seen plenty of physicians or plenty of people that have their own agenda, not all physicians, but some do, and that agenda may not be beneficial to the player. So that second opinion list we've negotiated with the league has a bunch of physicians on there that we've handpicked that are based all over the country and that our players can utilize throughout the season when there is maybe a disagreement with the team or when they just want another opinion on an injury. That would be the first one. The second one, I think, is we did retired player health screenings, and we did those in conjunction with the Retired Players Association. We did those for about 6 years, and those are free to all retired players, both men and women. And it was cardiac primarily, so they could get a free EKG and echo, which if you've ever had one, you know how hard it can be to get one and how expensive. And then we've also incorporated musculoskeletal care as well. So really a bunch of tests that players would probably have to pay out of pocket for or use their health insurance plan if they had it, as well as take multiple weeks to do. We try to provide to them in an hour and a half really on site, and it's all free. And that's really been kind of an initiative brought on by Joe Rogowski at the Players Association because of the amount of retired players that have passed away due to cardiac related issue that really was undiagnosed. So that was a big one as well that's expanded that retired players continue to do, and it's a really important one as well.